Welcome to our fascial fix for abdominal scar tissue. One of the main causes of scar tissue in this area is surgery, so it could be appendectomy or hysterectomy or even laparoscopy surgery. Whatever the cause, sometimes scar tissue can start to grow internally after surgery, and this can start to affect some of the internal organs and cause pain and other symptoms. In our video, we share some simple self-help myofascial exercises that can help to reduce some of the effects of the scar tissue and help to reduce your pain. However, we'd also strongly recommend that you seek out a trained scar therapist who can help to do some soft tissue work to reduce the effects of your scar tissue. In this exercise, I'm going to do a stretch for the abdomen, so for the front of your body here. So I'm going to lie on my back. At home, you can do this on the floor or on your bed, whichever is more comfortable for you. And just make sure that you feel your body relaxing on the floor or your bed. And allow time for this whole area on the front of your body to start to relax. For some people, just lying flat like this can be enough for them to start to feel a stretch in the abdominal area. However, if you want to feel a deeper stretch, you can then bring your arms up over your head and just let them rest on the floor or on your bed. So when you're here, just noticing how things feel in your abdominal area. Sometimes if you've had any kind of surgery in this area, things can be tight. Also, if you've had or have any respiratory issues, because the diaphragm, which is a muscle that sits underneath your rib cage, can make this whole area feel tight. And also if you've had any digestive issues. So as you're here, just allowing time for your body to start to release and let go. And you may notice changes or sensations of the tissues softening in your abdominal area. And that's all fine. Just allowing time for things to start to release and let go. This is a great stretch for anybody who's had any pelvic or abdominal surgery, because it starts to help to just release some of the restrictions that may have formed around the scar tissue site. And sometimes the body can create too much scar tissue, and that can start to cause restrictions. So this is a gentle way of starting to release some of these restrictions. If you feel that this stretch is not enough and you would like a deeper stretch, then you can also do this over some pillows or even over a Swiss ball. So doing the stretch just over a couple of pillows can really make you feel a much deeper stretch into your abdominal area. And you can also then again bring your arms up over your head, just creating a deeper stretch in this area. And again, whichever version you're doing, whether you're lying flat or whether you're leaning over something, make sure that you're here for at least a couple of minutes. And this gives time for the fascia and the tissues to start to release and let go. Really good for anybody who has digestive issues, scar tissue, respiratory issues. In this exercise, we're going to work on our hip flexors using myofascial balls. You can use either one ball to work on one side at a time, or you can work on both sides together. The choice is yours. The area we're going to work on is just inside the hip bones. So if you feel the side of your pelvis. You've got the bones here, and just inside them, so coming towards your midline, there's a little sort of gully just inside the bones, and that's where you want to place the balls. So not right in the midline here, but more just inside where you can feel the bones. So placing the ball or the balls here and lying either on the floor or on your bed, whichever is more comfortable for you. Just allowing time for the tissues to start to relax around the balls. Being aware this is quite a sensitive area, so sometimes it can feel quite intense, which is why sometimes when you start it's better to do one side at a time. But releasing your hip flexors can help improve the mobility of your legs and your pelvis. It can take pressure off your groin, and it can help with lower back pain as well. And as long as you're here for at least a couple of minutes, then it's allowing time for the tissues to start to release and let go. This can also help for people who have any pelvic abdominal scar tissue, as this starts to help to encourage the body to release some of the excess tissue it may have formed, and that helps to reduce any discomfort you may feel around this area. In this exercise, I'm going to do a spine twist. To do this, I'm going to lie on my back with my knees bent. So when I'm here, I'm now going to drop my knees over to the right and allow things to start to relax. Now, if you're like me and you find that your knees don't touch when you're in this position, you can put a pillow in between them, and that just helps to support your legs and your hips and means that you can allow things to release and relax. The spine twist is a really nice exercise to do to open out your hips and all the way through into your back. It's important to keep both shoulders on the ground when you do this, so the actual twist is coming in your lower back and in your hip. And by doing this, this can start to release some of the restrictions that may have formed, particularly around the side of your hip. And these can be contributing to lower back pain and hip pain, even leg pain. So as you're here, you're just allowing things to start to release and relax. And you may feel sensations that may be in the area around the side of your hip, or even coming up into your back or down into your leg. So whatever you're feeling, that's fine, that's okay for you. And if you want to create a slightly deeper stretch, you can straighten your top leg out. And this will stretch more into the side of your hip in particular. So this is a great exercise to do if you have lower back pain, if you have knee or hip pain, and it can really help to release round into your back as well. So I can feel this coming up into my mid-back, and sometimes people feel it coming up into their shoulders. And so as long as you're here for at least a couple of minutes, then it's allowing time for the tissues to start to release and let go. And then we can do the exercise on the other side. Coming back to the midpoint and then dropping your knees to the other side. Again, my knees don't touch. So I'm going to bring the pillow over again and place that between my knees. Again, this is just allowing my body to start to relax and release, and starting to feel a stretch coming into the side of my hip. If you're comfortable doing this exercise on the floor, that's great, but you can also do this on your bed if that's more comfortable for you. And again, if you want to create a deeper stretch, then you can straighten your top leg out and just allow it to drop down. And so the weight of your leg is now creating a deeper stretch coming round the side of the hip. You may feel it more in your hip, in your back, in your leg. Wherever you're feeling it, that's fine. That's your release pattern. And you're just waiting for a sense of the tissues starting to release and let go. So really good for helping to loosen your lower back and mobilize the tissues here, and for starting to release around the sides of your hips as well. So just being here for at least a couple of minutes allows time for the tissues to start to release and let go.